Recently, I was asked about what privacy awareness training can you do at the clinic to keep privacy awareness top of mind? How do you keep privacy awareness top of mind in your practice?
You are listening to Practice Management Nuggets podcasts. Tips to help you start, grow, and improve your healthcare practice and your career. I help you manage the pink elephant in the room. Get the show notes from our website at practicemanagementnuggets.live.
Well, as an employer and a healthcare provider, you are responsible to provide training to all of your employees about privacy awareness. If you don't provide the training, if the employees don't understand the policies and procedures, and there is a privacy breach or a complaint, then the healthcare provider is more likely to be held accountable under the legislation and face penalties, including fines and even prison, even if the individual that made the mistake or the error or that malicious event was the individual that did that deed. So just because you didn't have privacy awareness training in place means that you cannot demonstrate that the employee should have known better. And the custodian, the healthcare provider in the organization, is the one that's going to be held accountable for those errors or perhaps malicious events. So you need to protect your organization and your patients. Equip your staff with the information that they need to confidently and correctly handle personal health information. Now, healthcare businesses who want employee and supervisor level privacy awareness training to support key policies, procedures, and risk management programs need a privacy awareness training program. Now, this doesn't have to be difficult, and it shouldn't be a one-time event. So I'd like to share with you a short demonstration that I did in answer to a particular question about personal health information numbers and whether or not you should share that with your schools. Now, this is a useful little bit of training, but also what I want you to pay attention to is this was really easy to be able to create. So if you've got a common question that is coming to your staff or from your staff about privacy, then you can create a short little training video like I've created here and be able to come up with a customized response that you can share with everybody without having everybody in the same room at the same time. And then you can put it into your training library so that you can pull it out and review it on a regular basis or on an as-needed basis. So let's take a look at this little short training video. I want to provide you an example today about what you can easily do to share short messages. So in this example, we're going to talk about the question, should you provide your child's health insurance number to the school? As a parent, I know that we are often requested to provide our children's health information number to a variety of service providers, including our schools. Firstly, we need to evaluate if the information that is requested is personally identifying or health information. And we can clearly see that your health information number is both personally identifying and it also relates to health information. When it is required to provide a health service, but because a school does not provide a health service, you are not required to provide that health information number to the school. Now, most health privacy legislation states that someone who is not providing a health service cannot compel an individual to provide their health information number. Most often, the school is using the health information number to uniquely identify an individual. This is not for the purposes of providing a health service. Now, when a school is involved with a partner, for example, public health, to provide a health service located at the school, for example, vaccinations, then you may be compelled to provide a health information number to the public health. And what I would suggest that you do is that you don't provide the health information number on a form that you fill out to the school as part of that school registration process. But when they do the vaccinations, then of course you will need to provide that health information number because they are providing a specific health service. So then I frequently get questioned about what happens if my child is hurt at the school. Well, there's a common myth that if you don't have your health information number, then your child's not going to get care. And that's just not true. If your child gets hurt or has become sick at school, the school is going to call the parent, who will provide the health information number to the healthcare provider if that's required. If an ambulance or an urgent care is required, the ambulance will provide urgent care first and get the health information number from the parent later. So what are the risks of sharing your health information number to the school when they don't require it to provide a health service? Well, the health number may be misused. It could be used for identity theft. It might be involved in a privacy breach. Now, I know at my son's school, they have student helpers who have access to a lot of information, including a lot of the field trip forms that they've asked for the health information number. And those forms are just sitting at the desk, and somebody who should not have access to that information could readily have access to it. So in my mind, the risks are pretty high that that health information number that's put on a school field trip request form could be misused. So I don't provide it. And now I know that teachers are really good about asking to have the forms completely filled out. So in that spot where it says health information number, I just say not applicable. The teacher's happy because I filled out the form, and I'm happy because I haven't provided information that I don't think the school needs to be able to have a field trip for my son. Now, instead, the school may view the health information number at registration, for example, as a method to verify the identity. They can record that they asked for it and it was provided, but they don't take a photocopy of it and they don't record that health information number. Now, if your child has additional health risks, you might want to keep the health information number and the in case of emergency information directly with the child. So if you have a child that is a high risk for a health incident, then you may want to reconsider this information. But generally speaking, I think that you need to make sure that you have your health information number with the individual and not provide it on registration to the schools as part of verifying the identity of your child. So I want to encourage you to be privacy aware. Keep your personal information safe. Share your personal information when it's necessary. And if you collect personal information, ensure that you have the legal authority, that you have safeguards in place to keep the information safe, and inform the individual why you need it, how you will use it, and how you will keep it safe. Discuss your questions with the privacy officer. So you need to know who the privacy officer is. So I hope that this short video has helped to demonstrate how you can take a question that you get frequently from your staff and provide a short explainer video. And this is just PowerPoint slides. It's not difficult to do, and tools that you probably have in place so that you can analyze the question and provide some alternative resources for your healthcare practice to make sure that privacy awareness is top of mind for your organization. Now, there are other things that you can do as far as being privacy aware. Now, a super simple way is to do your privacy awareness training program is start with your health information, privacy, security policies, and procedures manual. Take a couple of policies and procedures at a time and make that the topic of the month. Make sure that your staff have access to those policies and procedures and you can circulate it for review, for editing, and for instruction about why this is important, how to implement it, and any additional scenarios that you can provide to give it more meaning and more context. Now, as a member with Practice Management Success, you have access to video training that you can download and share with your team based on a common template of health information policies and procedures. So if you haven't taken a look at that, make sure you've got follow the show notes here, and you can access this other additional training content as a member of Practice Management Success and then share in your healthcare practice. Other resources that are publicly available are things like podcasts. I host the Practice Management Nuggets for Your Healthcare Practice podcast, and I've got 4 years, almost 6 years, of information from guest experts and training podcasts that are available there. So you can take a look on that podcast, see if there's a particular topic that is responsive to questions that you're having at the clinic, and then you can share that link for the podcast. You might need a privacy awareness training course that you develop in-house, or you can go to a trusted vendor to provide privacy awareness training online for your teams. So I recommend Corridor Interactive. They are my training partner, and I've created privacy awareness training programs specifically for healthcare practices in Alberta, Ontario, dental practices, and across Canada. So that is another trusted partner that you can take and make use of to implement a privacy awareness training program in your organization when you're starting a new clinic, when you're onboarding new employees, and as a regular refresher. And of course, you've got lots of resources in this Practice Management Success membership to help provide privacy awareness training in little bits at a time throughout the entire year. Now, I want to remind you that October is Cybersecurity Awareness Month. So cybersecurity awareness is a promotion from the National Cybersecurity Alliance in the US, and this has been going on since 2004. Information Managers has been a privacy and security champion for a number of years with NCSA, and you can become a champion as well. So it doesn't cost you anything. You sign up, and then you'll get access to all sorts of resources that you can download and use in your practice. So you don't have to use them all at once. You can take a poster, an infographic, a little video, some articles, and disperse it throughout the year so that you've got some content for the entire next year about cybersecurity training. So make sure that you share this information with your privacy officer, and then you can also get on board with Cybersecurity Month. Of course, in October, I'll have lots of additional resources that I can share with you so that you can share with your healthcare teams for cybersecurity and privacy awareness training. So that was our question about tips to do privacy awareness throughout the year, and I hope that these tips and resources have been helpful for you. I love surrounding myself with practice managers and healthcare providers and vendors who want to start, grow, and improve their practices. I want to help you with more great tips, tools, templates, and training that you can use right away. I search for guest experts who will share their #1 tip with you. Let me know if there's a topic or a guest expert that you want to hear on Practice Management Nuggets for your healthcare practice. Until next time, I'm Jean Eaton, your practice management mentor with Information Managers.